Hi, my name is Carrie Wall, and today I'm going to talk to you about the benefits of dry needling. Dry needling can be used in any muscle group. It could be used for people that have neck pain, back pain, headaches, fibromyalgia, plantar fasciitis. It also is used for range of motion restrictions. It can help increase the range of motion. We use it when there has been a plateau in our manual therapy where we haven't seen a big improvement in pain reduction or range of motion improvement. We will use dry needling to help get us over that hump. It's going directly to the trigger point. When you're performing manual therapy, you're going through skin, tissue, and other muscles to get to that trigger point. And with dry needling, the needle, it goes directly to the trigger point to release that trigger point. And what's in that trigger point, which making it is so painful, is it's a local miniature contracture in that muscle. And there are a lot of chemicals that keep that muscle contracted. And when the muscle is contracted that way, there's also a decrease in blood flow to that trigger point and that muscle, which is causing the pain. So the muscle, there's theories that talk about how the muscle is turned on a lot more than the other muscle fibers, and that's what causes that trigger point. And when you needle that particular area, it releases the trigger point. The chemicals get released, and when the chemicals are released, the contraction goes away, and there's increased blood flow to that muscle, allowing it to function like a healthy muscle. So before, there was a lot of chemicals that were causing it to be a contracture or miniature contracture in a muscle. And the blood flow, because of the tight muscle, doesn't go into that muscle as well as a healthy muscle. So with dry needling, the individual muscle band that has that contracture in it gets released, and all the blood flow starts going to that muscle again, allowing it to have a healthy function. You can see results sometimes instantaneously after the needling session is over. We usually like to needle usually around once a week, maybe twice a week. It might take a couple of visits to get the trigger point to completely resolve and go away. It might take 6 to 8 visits. It all depends on your particular impairment that you're coming in for. So the number of times a week and the number of times total that you will be needled all depends on how long your issue has been going on, and how many muscles we need to needle. We use trigger point dry needling in Revive as part of a comprehensive plan of care for you. So when you get needled, you also are doing your exercises and other things. We also like to do some manual therapy just to work through that trigger point after we're finished working with it as well. So talk to your physical therapist that you've been seeing and ask them if dry needling is something that is appropriate for you. Thanks.